Biofilms are aggregates of bacteria which can form layers that cover surfaces. These layers allow the bacteria to become stronger and impenetrable to drugs. Biofilms thrive in water and are a common mode of bacterial growth. They can be used to our benefit in waterproof technology, improving aerodynamics of ships and corrosion in pipelines. Conversely, they can have detrimental effects in health and disease. One of these is in cystic fibrosis, a respiratory disease characterised by the clogging of airways in the lungs due to mucus buildup, which causes chronic lung infection and breathing problems. A bacteria called Pseudomonas aeruginosa can then form biofilms, which blocks the action of antibiotics trying to treat this infection. The University of Southampton has been working on the dispersal of biofilms to improve action of antibiotics used in cystic fibrosis. We spoke to Professor Jeremy Webb about a potential treatment he has developed and how it works.
So the treatment that we're working on is a molecule called nitric oxide, and we discovered that this is a signal that tricks bacteria into letting go of the biofilm structures, which disrupts the biofilm. And that means that when the bacteria are dispersed from the biofilm, they become sensitive to the antibiotics again.
Saul Faust ran a clinical trial using this treatment at Southampton General Hospital, where we spoke to him about the results.
We admitted patients with cystic fibrosis overnight to the research facility here at the hospital in Southampton, and we gave half of them nitric oxide to breathe alongside their regular antibiotics, and half of them didn't receive nitric oxide, they received a dummy gas. And then we looked at the end of the study at the differences between the bacteria in the sputum of patients who'd had the nitric oxide compared to the patients who hadn't had the nitric oxide. And what we found was less bacteria, less Pseudomonas biofilms in the patients who'd had the nitric oxide gas.
We spoke to Jade Ashton, a cystic fibrosis patient and researcher, about the treatment. So how could this treatment affect the lives of people with cystic fibrosis?
Hugely, yeah. I remember when I was first looking at the data from this clinical trial, I was so overwhelmed that I started crying because it was just incredible that something so simple could be that effective. So yeah, it really could remove the main cause of mortality in CF. That is what people with CF are still dying from, the lung infections. So yeah, with a life expectancy now, for people born now of 40-ish, it could have a huge impact if it was started early.
With more funding and a larger clinical trial, a treatment such as an overnight nitric oxide inhaler or even a drug to cause targeted nitric oxide release within the lungs could become available to cystic fibrosis patients in the future.